The common belief that running injuries emerge gradually, like cracks in pavement spreading under the pressure of repeated use, has shaped how runners and coaches approach training. But emerging research challenges this assumption. New findings suggest that many running-related injuries may not result from a slow accumulation of stress over time, but rather from a single, poorly executed or excessive session. That one-off day, when fatigue is ignored, form is compromised, or the body is pushed beyond its current capacity, may be the true tipping point. This insight doesn't excuse long-term overtraining or poor planning, but it shifts the spotlight toward acute decisions made on a day-to-day basis. For runners, this means that vigilance around each individual workout is crucial. It's not just the overall mileage or training cycle that matters, but the specific context of each run: how well you slept, how hydrated you are, how your joints feel that day, what shoes you're wearing, and whether you're paying attention to early signs of strain. This should be seen as both a warning and an opportunity. The warning: even one run done under the wrong conditions can lead to serious setbacks, from tendinitis and stress fractures to muscle tears and joint inflammation. Often, these injuries appear suddenly, but their true cause is a subtle biomechanical breakdown that may have occurred in just one careless session. That sprint at the end of a long day, the hill repeats when your calves were already tight, or the long run you squeezed in without proper warm-up can all be the inciting events. However, this knowledge is also empowering. It means runners may have more control over injury prevention than previously thought. Instead of fearing the slow, invisible creep of damage over months, athletes can focus more on making smart, responsive choices every day. Taking a rest day, adjusting pace based on how you feel, or stopping mid-run if pain arises may be far more effective than sticking rigidly to a preset plan. Listening to the body is not just cliché advice. It could be the most important injury prevention strategy. Coaches and runners alike should consider reevaluating how training logs and progress are measured. Rather than simply tracking distance or frequency, attention should be paid to qualitative markers. How did that run feel? Were there signs of compensation or discomfort? Was the terrain or weather unusually demanding? Injury risk may correlate more strongly with the worst session than with overall volume. It's a reminder that resilience is not built through blind consistency, but through adaptability. The body is robust, capable of incredible endurance and performance, but it is also sensitive to sudden missteps. With thoughtful planning, attentiveness to daily variability, and a willingness to modify or skip a session, runners can significantly reduce their risk of injury, not by doing less, but by doing smarter.